Welcome back to Basics session from the Royal College of Podiatry, and today we're discussing Claudia Quena Syndrome. I've got Billy Middleton here with me. We'll introduce Billy in a wee second, one of my patients. But before I do that, I want to just go through what Claudia Quena is, just to refresh your memory, and to discuss some of the red flags and common symptoms. So Claudia Quena Syndrome is one of the most important conditions for musculoskeletal clinicians to recognise. Now, it is relatively uncommon. However, delayed diagnosis can result in permanent neurological injury affecting bladder, bowel and lower limb function. Claudia Quena, meaning horsetail, is a bundle of nerve roots at the lower end of the spinal cord, and these nerves supply sensation and function to the bladder, bowel, other organs and the lower limbs. CES occurs when the nerves become compressed, most commonly by a large lumbar disc prolapse, although spinal stenosis, tumours, infection, trauma and inflammatory conditions may also be responsible for this. Common symptoms: lower back pain. How many people have lower back pain? A lot. Sciatica affecting one or both legs, leg weakness or altered sensation, difficulty walking, changes in bladder, bowel or sexual function. Red flags include saddle numbness with altered sensation, new urinary symptoms, loss of bladder sensation, urinary incontinence problems, bowel problems, progressive neurological weakness, or bilateral leg symptoms. So just think about that for a moment, especially lower limb healthcare professionals in this, as well as our colleagues or physiotherapists. Now, one of the most important concepts for clinicians is recognising the difference between CES incomplete and CES retention, which is CESR. Now, in CES incomplete, the bladder still functions, but not normally. Patients may report altered urinary sensation, passing urine, reduced awareness of the bladder filling, and then difficulty maybe emptying and not fully emptying the bladder, or feeling like there's this incomplete emptying. This is often the stage where urgent recognition and treatment may prevent permanent damage. So really important when we're talking to our patients that we're having these conversations. Any changes in this? Is there any alteration? Please don't think that that's not within your scope. It absolutely is. Now, the CESR, the bladder is largely lost its nerve supply. Patients may develop painless urinary retention, so they might not necessarily be in pain, overflow incontinence, and more severe neurological defects. By this stage, significant nerve injury may already have occurred. And the challenge for clinicians is that patients rarely present saying they have Claudia Quena syndrome. They often present with worsening symptoms of lower back pain, altered sensation, or subtle changes in bladder function. The goal is not simply to recognise CES, but to identify the patient who is developing CES before irreversible damage occurs. Now, Billy's presentation is a little bit different to some of this, and I felt like this was really important having, as I was working with Billy and some of his lower limb challenges this year and a half, and Billy has very, very kindly agreed to talk about his experience of this from before this to what happened and the whole process of to where we are now. So a massive thanks, Billy. Honestly, this is amazing.
If it helps.
Absolutely.
The bonus.
Life before CES.
Before, I was a carpenter. Lots of work. I had my own business with a business partner. They played lots of sport. I cycled all golf, tennis, lots and lots of sports, and just enjoyed socialising and just enjoyed life, really.
But obviously your job was very
My job was physical, manual. Yeah.
So you were fit, is that what you're
Yeah, I
trying to
was
say,
fit. Yeah, I was fit.
Okay. You were fit.
I was fit. Okay.
You're still fit.
I was fit there.
Fitter. How long ago did you get this? Did it happen?
Just over 10 years.
Right. So we're going to talk a bit about fit, active, business, carpenter, that's the word. Yeah. You make I think we should talk about, you make specialist windows, don't you?
Yeah, I made traditional sash and case windows and doors.
Pretty specialist stuff.
Yes, a lot of specialist stuff. Yeah.
And you're still doing that, aren't you?
I still help my friend
right.
now and again, yeah.
So let's take it to the day that this happened. So we'll talk a wee bit about your symptoms. Now, obviously, you're a tall guy. What height are you?
At the time, I was about 6'2".
So you've lost.
I've lost 7 inches. So.
Do you know what? I've got no sympathy.
No,
Not at all. And as somebody who's 5'2", right, you've got far too much.
I know. That's why I'm giving it away, obviously.
With me. Well, basically, you were and the reason I'm asking that is because the amount of people we get through the door with lower back pain, right, is staggering. You all know this. It's non-specific, lower back pain. You get somebody like Billy coming in, physical manual job, he's doing detailed work, he's lifting, and they come in with lower back pain. It's every day you see this. And this is really important because here we are with Billy. And you had been attending various clinicians. Talk to us about that.
Yeah, I'd attended a few, and then I found over a good number of years, I'd attended a different types of to find I suppose some sort of solution. I was always experiencing some sort of back pain. A lot of it was muscular because of the way it worked. Well, it was left foot forward, right foot back, and always working on your right hand side. So everything on the right side was a bit more muscular than the left. Anyway, so I would get lots of time where I wouldn't have any problem, and then all of a sudden I would get a flare up and I'd get a little bit of problem. And then I found a place that I really liked, and the guy I called Alan, and he was my place to go to, because every time I went to him, I got great treatment and came away feeling it, and it would last for maybe 6 months, 8 months, a year sometimes, and then I would just go back to him.
And what were you getting in those sessions? What did that look like? What kind of clinician was it? Was it an osteopath?
Yes, it's not the one that, cracks you and just more like fingers on and just moving your spinal.
Yeah, just a little bit, just little adjustments.
Gentle and more muscle. No, what was happening at times with me was my right sacroiliac joint was jamming. Was sticking. It was rising, so I was like off kilter. So he would release that, and that would release the pain. And
you would get months and months of
relief. So I knew when it was coming on, I could tell the symptoms, and I knew to book an appointment with him, go and see him and get it sorted. So it would either be one appointment and then go back a week later for a second appointment, and that would be it for months.
So excellent. And how long was that going on for, Billy?
With Alan, probably I was there for maybe, I would say 2 years or more.
Pretty decent. So you'd been in a few times in that time.
And I sent boys that worked for me who would experience maybe sciatica and things like that. I knew myself from obviously being experienced and getting these pains. I thought, no, you need to get it. So I would arrange appointments with them, with Alan, the balance, and he would show them, and they would come away feeling sorted, feeling that.
And then, which is not unusual, somebody tall, manual work, we know that sometimes we just need a bit of MOT in our bodies, we all do, and it worked to treat. Now, on the particular day where things were a bit different, and we'll not mention any clinicians and stuff, but you saw somebody different, didn't you?
Yeah, what happened was that Alan was really, really busy, and I had a bad spell of just lower pain round about the centre of my back across my hips. So I found another clinic that I had been to in the past. I got an appointment there, went for an appointment there, maybe I'd say a couple of days before or a week before. And then on the day, I managed to get an appointment there again and went along. So I went for the appointment, and I was in a lot of pain, and I wasn't moving very freely.
Was the pain similar to what you'd had in the past, or was it different?
Yes, it was similar, but it was a lot more severe. It was travelling down my right leg a lot more, and I was having trouble walking, and even walking into the clinic.
Any bladder problems?
No, not that I felt that any bladder problems or anything like that, because I think I wasn't thinking of that. All I was thinking about was, this is really painful, and if I've got to get something done about it, because it's just going to get worse, and I'm not going to be able to function at all.
Had it ever felt that way that day when you walked into the clinic? Had it ever been like that before?
I think maybe not that sort of pain. What happened before was my sacroiliac joint had jammed totally, and was having trouble walking, and I had to get off the floor by using a pole to get up, and then get taken to see Alan, and he sorted it, and after I got manipulated, it eased off, and I just took it easy for a good few days, and then I was fine again. But this day
was different.
Was totally different.
But there was no bladder issues, and you weren't numb across your saddle area?
No, not in. I wasn't looking for anything like that. I wasn't aware of anything like that. There possibly could have been, but I wasn't aware of it.
Did the clinician ask you any of those questions?
Not that I can remember that asked, and I think from sort of records that I got, certain questions weren't asked.
Okay.
So I went into the clinic, and I got taken to the room and then told to get undressed and get onto the...
Get undressed.
Within reason. Within reason, which took me a long time because I could hardly bend, and trying to get trousers off and things like that was so painful. But I managed to do it. I managed to work my way onto the couch, and then he came in, I think he came in, put his head in the door, and I was still struggling to do it. But I go on the couch, and I was lying face down, and he started to manipulate me in certain. He tried a couple of things, like a bit of massage here and there, whatever, and then he put his both hands on my lower back, to just above my sacroiliac joint, right on my lower spine, was pushing down on that area, and then asking me to arch my back, push with my arms and arch myself up as he pushed down on the area. And he did that for a few times, a couple of times, and pushed and arched, pushed and arched, and then told me to stop, and then a bit of massage or manipulation of my buttocks, massage I think on my hamstring area, and then that was it finished. He then said, right, get off the couch and get yourself ready. So he left the room, and I attempted to get off the couch, and I was in agony. I could hardly get off the couch. It took me ages to get off the couch. I was having to grab hold of it, because every time I straightened up or put my feet on the ground, shooting pains in my back. So then I had to try and get dressed, and at one point he put his head back in the door of the clinic and said, Are you okay? What's taking so long? I said, I used the swearing word, agony. And he said, okay, are you nearly done? I said, yep. And then he just closed the door and went out to the desk. So I managed to get my shoes on, and I came out the clinic, and I was holding on to the wall to walk along the corridor to get to the pay desk.
You weren't doing that when you came in?
No, I was in a bit of pain walking, but I wasn't anything like that, where I was, it was like physically jarring pains as I was putting my feet down. When I was standing waiting to pay, he said to me, listen, it'll be fine. Once you go out and you walk up and down, you'll be fine. Have a good walk. It'll ease off. While he was saying that, I'm standing holding the desk and trying to arch my back so that I'm away from the pain. And then he just took his next customer. I paid and left. And I was walking, when I was walking the street, trying to get there, I could see people looking at me, because I was like, I don't know, contorted to try and physically in pain. You could probably see it in my face. So I tried to walk, and it was scary. So I walked all the way. I had my car outside, so I knew I had to move my car to my workshop, which wasn't maybe, say, I don't know, less than half a mile away. So I managed somehow to get in my car, and I was driving in my car almost straight in the got to my workshop and managed to get out the car, and one of my workers was standing outside and was physically shocked and said... Another sweary word. Said, I suppose, beep. He said, I thought you were away to get your back fixed. And I said, I have been, I've just been told. I said, it is painful just now, but I've been told it'll ease off and things. So obviously doing as your clinician tells you, I just tried to carry on. I just walked about the workshop in pain, and got a cup of tea, or somebody made me a cup of tea, because it was physically struggling even just to stretch my arm out and hold. I had to hold my cup with two hands and drink. So anyway, the day went on, and I knew it was just getting a bit unbearable. So I thought the best place to just go home. So again, I had to drive. I drove home, got home. I lived at the top floor of a tenement flat. got home, no one in. I thought, right, I couldn't, I tried to sit, and every time I tried to sit, it was just pain, and I had to get back. It was painful going down, and it was painful coming back up. So and I thought, right, I'll just try and make a cup of tea. I tried again, and I couldn't even lift the kettle from one side of my kitchen to the other side. So I couldn't even make a cup of tea. And I thought, oh, well, I remember before I could hang on to the workshop, and if I bent down and tried to do exercises, maybe it would release any tension in my, because I knew that obviously from the past I'd been told by the guy at Balance that when I was having my sort of spasms, I was tensing myself so much, then the other muscles were just protecting. So that's why I was getting leg blocked. My whole back was getting blocked because everything I was stiffening up. So I knew that I was trying to protect this area. So I was stiffening up, and I thought, right, I need to try and move to try and get this released. But so the whole evening went on, and my partner wasn't in. I was just in the house on my own. My two wee dogs had to get walked, and I knew, and I was just like, it was getting later in the evening. It was now coming to 8:30, 9 o'clock. I knew they had to go out, so I to get them ready, which took forever. Got them ready, went downstairs with them, and I was in pain. They were walking, and I couldn't even lift, which they're Cockapoos, which I hated doing, but I had to. And then when I got sort of halfway around the walk, I could feel my right leg I was getting terrible pins and needles, and I couldn't feel, it was just numb. And by the end of the walk, I was dragging my right leg with me all the way, and then I just had to get to the house, unclip them, let them run up the stairs, and then climb the stairs, holding on to the banister, go in the house, coat off, and I just thought, right, I just need to go and lie in the bed on my side to get any. So I lay on my side, and I pulled my legs up in a sort of fetal position, and I got a bit of relief from that. But I was lying there waiting, and then my partner came in about 10:30, and I had to say, listen, I'm in Newthay. And she said, right, we'll phone accident emergency. I said, no, I'll be fine, just leave it for a bit. I've been told it'll ease off. I'll just leave it for, I'll see how it is in the morning. But I tried to move it, I couldn't move, and I thought, right, okay. And then I was sitting, and and then I started to touch, and I could feel, I can't feel myself touching my legs. And then I thought, this isn't right. And I couldn't feel myself touching my buttocks, and I couldn't feel myself touching my scrotum. And I thought, right, so you had that saddle is numb to the extent that I can't feel it. And the pain was still, it was getting pretty intense. So I phoned 911, whatever, 111. And they asked me a lot of questions. Then I waited for half an hour, and then a paramedic phoned me. I spoke to the paramedic and told them about it. And that I had the feeling that I had to urinate. So I couldn't get out of bed. So I had to urinate into a bucket that was lying on the bed, which I managed to do, but wasn't aware that I was urinating. Couldn't feel it, and I couldn't feel if I'd finished. I had to ask my partner if I'm still going, and we're finished, and it's obviously finished. So I relayed this to the paramedic and everything like that, and then the paramedic said, right, okay, we'll need to get an ambulance for you. So the ambulance came about, say, 2 hours later. They came in and asked me some questions, and then they were trying to get me to sit in position, but I was screaming in pain. So they had to give me a morphine injection, and then they got me to sit in position, and then I fainted. And then they brought me round again, got me up, got me into the wheelchair thing, or the chair for going downstairs, and then they blue lighted me to the hospital. And then I ended up in hospital. It took quite a while from me getting waiting outside the hospital in the ambulance for a good hour and a half, 2 hours before I got in, and then waiting in the A&E, going through questions like that, then going getting, I think it was just, I don't know if it was an X-ray or whatever first, and then getting taken to a ward, and then getting taken to, and this is, I was aware because I think it was the paramedic had said to me that you've got like a window of like 14 hours or something like that.
And you knew it was the morning you
I knew it was the morning that it happened, and then I knew I'd gone through a night, and I now knew I was into the next day. And it just seemed to be everywhere they put me in a trolley, there was a clock in front of me. And I'm working out in my head, and I'm going, I'm close to 4, getting closer and closer. And I really don't, at one point I lost track of time because I got moved to one ward, then I got an x-ray, then I got moved to another ward, and I got the doctor came in again, questions and prodding me with pins in the feet.
Can you feel
this? Can you feel that? And doing all the thingy. And then I got, I think it was a CT scan. And then I got taken back to the ward, more questions, waiting and things like that. And then I got taken for an MRI. And then I got taken from that ward, rushed to the spinal ward. And by then I was in serious pain. I was getting morphine injections. I don't know. I think it was every half hour they were saying to me, we can't give you any more. And it was like I was getting abdomen pains were like cramps, and I was climbing the walls and I was sweating buckets. And what happened was I found out was there was a brain operation, or someone got rushed in with a brain that needed a brain operation, so they got put in front of me. And so I got pushed back even longer. And then I got operated on, and they had to remove, what had happened was the disc had got shoved into my spinal column, and it trapped all my nerves, my lower, so they had to cut away the bit of disc to relieve the pressure on my spinal column. And then back to the ward, and then I don't know, once I came round, the first thing they done was get me back up on my feet to see if I could stand, or whether, touch wood, fortunately enough, I could stand. And then from then it was just rehabilitation, more walking sticks, and just physio, bit of physio for then. But then it was just, most of the time it was myself getting out of bed and walking around the ward. Up and down. But I thought I was only in the hospital for maybe 3 to 4 weeks, but apparently I think I was 6 to 8 weeks in hospital because...
Jeez. So time just,
because I don't get me wrong, I was having a nice time in hospital. I know it's funny to say.
Were you high?
No, I might be a bit high, but I was talking to people that was in wards with other people. I was talking to them, and they a nice basket with tea bags and biscuits and things like that. So
you were quite comfortable.
I was quite comfortable. People were bringing me some nice stuff, and I was getting some nice food brought to me and things like that. Right. I was enjoying. So
you're well looked after. What hospital were you in?
Queen Elizabeth.
The spinal ward. Yeah, we know it. Yeah,
and one of the things that the main the head of the department kept me in for was because I hadn't had a bowel movement, and she said, you're not leaving here until you've had a bowel movement. And there was a couple of doctors doing the rounds who did say now and again, why are you still here? Because obviously they needed to, but she said, I'm not letting you leave until you've had a bowel movement. So that took a long time, and when it happened, it happened. And then after that, it was maybe another week or so, just and also regulating and doing the pin thingy on this circle, the checking the distance where I was still numb, where I was saying, just checking all that sort of thing, and as I say, just checking my mobility.
So you were in about 6 weeks.
Yeah.
Goodness, Billy. Wow. So they obviously did the surgery. More than likely looks like that compression down with the extension, and you were extending as the clinician was compressing your spine down.
It was the only time and place that there was any pressure put on I didn't fall and onto my back. I didn't have a car crash. I didn't fall off my bike. I didn't fall off anything at work. That was the only time that any pressure was applied to that area of my back.
Was that a movement you'd had in the past? So you'd never done the extension? Okay. So, I think there's lessons to be learned there from, I think, listening to that as a clinician. Your overall history and your symptoms that day already had some things that clinician didn't know you as well as the one. It's just like the perfect storm, isn't it? Because if you'd have seen that your usual clinician, they would have recognised, wait a minute here, Billy, there's something not quite right. Yeah. And they certainly wouldn't have been doing high velocity grade 5 minutes on you anyway.
I said he
wouldn't do that
He would do
anyway.
that to anyone. He said he'd be lucky if he would do it to his 6-year-old daughter.
Yeah, who's pliable
But,
and malleable. Yeah. So there's been a few things there, isn't there? So if you've seen a different person, they're not knowing your full history. They're not really understanding that things are a bit different. Actually, this is a bit worse than my usual,
Yeah.
and they've probably done something at a velocity range with your spine and extension, with posterior to anterior compression, just like this perfect storm, and contributed to this. Now we don't know if this would have happened anyway.
Yeah.
There's no point in.
No, I know. There's no point in
Yeah.
saying it. You can't be 100% sure, but I can be 100% sure that is the only time that any pressure impact is put on that area in my back.
So let's kind of look at, I suppose you were in hospital 6 weeks and you had the surgery, went well, they stabilised your back, I take it. Do you still see, do you still get any checkups from spinal?
Not from the spinal unit. No, I see the boy Alan every maybe 6 months or something like that. I'll go and see him if I feel as though I am again. I feel if any problem in my it's mostly my C3 joint still that I get. I feel it locking in a way, and maybe my right buttock. I get a bit of muscle tension in it. Touch wood, any other back pain, I don't have anything of it.
Gone. Well, got to have a bit of a silver lining.
Yeah, that's it.
There's got to be something good.
That's a tip, yeah.
Right, and then I know that you've got some of the other. Yours is a bit different. You've got some bladder control, haven't you?
I've got bladder control that I have to self-catheterize twice a day, once in the morning, once before I go to bed. Times, the odd occasion, I feel as though I have to do an afternoon one. But
how did you learn that? Did you get shown how to do that?
In the hospital, yeah. It's very easy.
Is it pretty easy to do? So you're like a pure dab hand at that now?
I know, I'm not going to demonstrate. But
I don't think any is needed. You know, right? That's beyond my scope of practice. I'm not doing that for anybody. And essentially, it's just to help. Have you ever had any infections or anything as a result?
For a long time, I was having lots of urinary infections. Early days, I was having them not knowing that's what it was, and a couple of occasions I almost had sepsis because I let it go too far. Is it riggers they call it, where they're uncontrollable shaking? I had that, and I think it was 3 occasions. After I found out, it was one occasion where I just had to get a taxi straight to A&E and go in and then get
so just think about that intravenous antibiotics. Golly, so the human impact this has had. And we'll talk about podiatry intervention and what we're doing for Billy at the minute and our role in this. And so talk a wee bit about Billy, how this has impacted and changed your life from Billy before this.
Firstly, my business partner found it the ideal moment to remove me from the company. So I lost my obviously I can't move in the same way. I can't run. My balance is bad. So all my sports, I've lost all my sports. I played 5-a-sides for 35 years or 40 years. I played 11-a-side football even up to my late 50s. I would still be playing today if I could run about. I played tennis, played golf. I can't cycle much. I can't cycle at all because of balance issues and feet issues with numbness in left foot. Can't feel pedal and stuff like that. Working wise, I can't lift anything. I can't. It's just tiny jobs. Employment, I can't really be employed because I can't sit for too long because my feet get very painful. I get nerve pain in my feet that get very painful, so I have to get up and move around a lot. So I can't sit around things. So then I can't do a manual job very much because, again, as I say, lifting anything or moving anything isn't great. I can now drive Well, I can drive after about, that was, say, about 6 years, 5, 6 years. No, sorry, not as long as that. About 3 years of not, no, 2 years. About 3 to 4 years, I can drive. I wasn't allowed to drive, but now I can drive an automatic. I can feel a bit with my left, but I couldn't do a clutch. I couldn't feel the biting point.
Who needs a clutch anyway?
No, the clutches are things of yesterday. So that helped me as well. Although, being unable to drive was a good driver for my health and my rehabilitation.
Walking.
Because I got out and I had to walk.
Yeah.
I had to walk. I was determined, because I'd been playing a lot of sport. I thought, right, this is where we are, because I was very lucky. I was apparently millimetres away from being in a wheelchair. So there's a bonus. So that was my bonus, and that was my drive, was that I'm not going to let this beat me. I'm going to try and live as normal a life as I can. So I just took it upon myself. Everything in the NHS was fabulous. I can't knock them. But one thing I would knock them for was the physiotherapy. They said that it would be at least 6 weeks when I got home before I would get any physiotherapy. Now, I realised in hospital how quickly I was, and how quickly I had to try and get muscle back and working and keep working at it and keep working at it. And I thought to myself, well, if I go home and I sit about for 6 weeks, I will be way down the line. I'll have hardly any strength in my legs. So living at the top floor was a great thing, because I knew I had all those stairs to climb. So I was stair climbing. I was going out and I was walking around my area. I was going back in the house. And so I was just building it up. And then I was a dab hand on my crutches. I could get around really fast on crutches.
Picture that.
Yeah. And then I was a member of a small gym. So I went there and I spoke to the guy who was running the gym, and he then got me a wee programme, helped me out, and religiously every day I would go and I paid for a neuro physio to come to my house. I had 3 appointments with her, and she gave me exercises to do and told me what was going on with my thing and how to reignite
the nerves,
or the muscles in the nerves. So this list of small exercises to do. So I just went every day. I thought, I'm not going to do them. I'll do them in the house to Sullivan, but I just thought I'll go to the gym because that'll make me walk. So I used to walk so far, and I would get the bus if I could. If not, I would just walk. And I would walk to the gym. It would be maybe a mile, and then I would do my gym session. I would come out. I would go get a bit of lunch, and then sometimes I would go back and do an afternoon session, and then I would walk home.
So your whole life became...
Oh, whole life was just, for 2 years, I was basically rehabbing and getting myself back that I could stand up properly. I could get up and out of a chair, just everything. Because I knew, I understand it. NHS is understaffed and things like that, but I just knew that I couldn't wait. I mean, I'm too impatient as well, and I'm not a house person. I like to be out and about.
So you got on.
I got on with it.
And then did you finally get your physiotherapy through the NHS?
No.
You didn't get it? All right.
I didn't need it. I felt as though I didn't need it. I'd already done all my rehab, and I was doing the rehab, and I got some private
physio.
Physio, and I was seeing that, and but I what do you call it? A trainer. A personal trainer that was in the gym. I spoke to him and had a few sessions with him.
You were just getting on.
He got me and watched, and obviously made sure I was doing things properly to help me build up the muscles up more and get more strength and more strength.
And it's worked a treat.
It worked. Yeah, it's worked. It's worked.
So we kind of met. Where did I meet you? Maybe about a year and a half ago.
About a year and a half ago.
It was probably, and it was your feet. Your feet, but
I won't show you them either.
No. Talk to me about your feet.
My feet, well, just that I have terrible nerve pain, especially in my left foot. I came in to see you because I had terrible heel pain along with the nerve pain, and need some sort of relief from the heel pain because it was stopping me from basically doing a lot of things. From walking was one thing because it was so painful walking. So I came to find
relief.
And I looked obviously the internet and your
Internet.
and your clinic came up, and here we are today.
We've done lots, haven't we? We've scanned. We've got lots of things going on, as you can imagine, because of the altered mechanics and the loss of sensation. The wee belly loads his feet. The fat pad atrophy.
Yeah.
You've got no fat in those feet at all, have we? It's
No.
like we're walking right on the bone. And you used to have a brace. I don't know if you brought the brace today. You've got the Ritchie brace.
I've got the Ritchie brace.
Let's dig it out. Let's pull that round. What else have you got in that bag?
Nothing. That's just my
that's your jacket.
I think
That's all right, but we'll talk a wee bit about that brace. You got a brace from the NHS, didn't you?
Yes, there was the woman I first saw for my walking in the NHS at Cartnavel. She was very good, and a few times I'd been to see her, and again it was my heels were, I was sore walking my heels and everything like that. So she then said, I think there's a brace that you could get. And she got me these two braces, and I got them. Amazing. And I found that they were great because I felt as though I was standing upright and I could move them. But the only problem with them was it was painful. Not painful. It was very uncomfortable trying to walk upstairs with them because they didn't bend. They were a rigid bar down here with Velcro, and
long shaft.
A sole plate, titanium, not titanium. Anyway, a thingy sole plate, which were in my shoe, which was fine. But obviously, unbeknown to me, I was losing fat on the sole of my feet. So that's why I was getting
pain.
And
then with these bony spurs now because of the impact on you.
So it's became that I couldn't wear them. I was wearing them sporadically. And they were giving me, felt great because I was able to ambulate, and I was moving faster, and I could walk with. I didn't have my crutches after so long, and every time when I went back, that woman had gone she'd moved on somewhere else. So anytime I went back and I had things, I was questioned, how did I manage to get them? So I take my hat off to that.
She's probably got in trouble for giving you them, Billy.
Unfortunately, she's lost her job.
She's been sacked
because they said, "Oh, right, okay."
She's done so well.
Those braces did take me again to another level where I felt, dare I say it, like normal human, whatever normal.
You were walking.
I was walking, and I felt upright again.
Yeah.
You know.
Yep.
And that's the problem. I don't feel, because of my balance problem, I don't feel upright, which I'm not. I know I'm not.
Yeah. And it's so from a podiatry perspective, belly, as you can imagine, is super complex. And when you come in to see me, I'm okay to talk about your feet. You're fine. Yeah. When you come in to see me, we had fat pad atrophy, we had plantar fascia. Now, if I believe it was a disgusting size, wasn't it? It was big. It was very thick. And I want to say it was up at that 12 mil or something. It was massive. It was massive. Now, to give you perspective for those that don't use ultrasound, a kind of norm, anything over 4 mils is deemed pathological. Billy was well beyond that, and both feet were sore, both heels. So we had some challenges there, and Billy's ambulation was, as you can imagine, altered, and he was, all his footwear and stuff was great, but there was challenges with the fat pad atrophy. We then had bony spurs, we had a very enlarged, very angry plantar fascia, when we had midfoot changes as well, with osteoarthritic changes around the midfoot, around the styloid process, which is that down your wee toe, Billy. See where your wee toe is at the side of it, where you're getting pain at the minute. We had some osseous changes around there, and we had basically changes, almost like a tailor's bunion around that area. Not quite as much as a tailor's bunion, but this sensitivity, because the wee Billy's loading his foot at that point, because he's altering how and then where he's putting those forces. So we had this osseous changes, osteoarthritic kind of changes around that area, and the joint capsule itself was inflamed as well. So we just had this storm of like left foot sometimes, right foot other times, and it's like, oh, right. What we've done over the kind of year and a half is we've just kind of went, right, let's just breathe. It's just typically, right, let's just see what we can tackle. And I think I've been honest with you and saying, Billy, I don't know if this will work. I'm pretty...
Yes, I and we agree that if we don't try it, we're not going to know.
Let's give it a bash.
You give it a bash and try.
And sometimes as a clinician, that can be you've got to be open and honest and transparent with your patients.
Honesty is the best.
I'm never going to say this will be amazing. Or, I don't know. I mean, actually, was it Monday I saw you?
Monday,
and we actually gave you a steroid injection on Monday, didn't we? Because you were in that much pain. I thought, Billy, we need to just, because of Billy's fat pad atrophy, before I'm shunned, we didn't go near the plantar aspect of Billy's foot. And we had a good chat about that as well, didn't we? About I was like, I don't want to put this near that, Billy, because I want to hang on to the fat that you've got there. If I could stick some fat.
If you had an injection, you could pump fat into my
we can talk about possibly hyaluronic acid, but there is these things, whether or not you'd be a candidate, but that's something we can explore. Yeah. So what we've been doing with Billy just now is we want to try and keep you moving, mobile and happy,
and try and give me some sort of
strong
pain
relief.
I'm not going to get pain free, but pain relief.
It's interesting when I'm working with you, Billy. What do I have to do? But when you take your shoes and socks off, what's the first thing I have to do?
Grab my foot and
grab his foot and go, are you ready? 3, 2, 1, go. Because that nerve sensation, we laugh about it, don't we? It's like, are we ready? Yeah. Let's go, I'm coming in. And then after that, you're fine. But that initial sensation, so just to be aware of that as well. And you've got to have a bit of fun with it. And we have a good bit of banter, don't we? When we're there, right? We're coming in, Billy. Now, very, very recently, we got Billy a Ritchie brace. So for those that are maybe familiar, not a clinician will be familiar with the Ritchie brace, is I've got a little bit of movement at the ankle here with this. I got Billy a cushioning around the heel as much as possible. We've got a bit of arch support, and then we've got the lengthened. This is basically just material. It's not doing very much. Now, amazing for the ambulation, amazing for giving that Billy walking normally, but now we're having problems. Let's talk about that, Billy. We're on to the next issue, right? Because I'm now changing how Billy's walking. I'm making different muscles do different things, which we're trying to do. I want you upright, I want your back well, I want the butt muscles working, Billy. But now we're loading. You can talk to me about the pain you're getting now, Billy.
Hold my hands up stupidly. I was doing as I was told, where I was doing half an hour in the house, moving it up 5 minutes, and I had done maybe a week of it, and then I put it on one morning and was wandering around and totally forgot that I had it on, because
it's easy, isn't it?
Yeah, it's easy. It's lightweight. You don't really feel it on your leg. Okay, when you initially put it on, when you tighten the Velcro, you feel that around it, but then after that, you sort of think, because you're moving around. I stupidly went out, and I went out all day long, and I forgot I came back to the house. When I took it off that night, I could have hit the roof, because obviously I'd been ambulating.
Done.
I'd been ambulating away like a good one, in my right foot, and it's on my left foot.
So it's left.
Yeah, maybe that's why. Maybe I did it on my right foot. on my left foot, serious pain around my left side of my foot.
The wee toe is the fifth digit.
My left hand side of my left foot is numb from my injury. I have some sensation, but it's basically numb. Well, there's areas all over my lower saddle and things like that. There's areas where I have numbness, but that is what my left foot is one of them. So I do have a bit of drop foot there as well, which this is helping.
This has massively been slowly catchy monkey, Billy.
Yes, slowly.
So what we're hearing here is patient compliance, and Billy's usually really good, but we all do it.
Just a moment of madness. I just forgot. So I'm paying for it, so I haven't been able to wear it for...
Well, I've told you no to the now until we get
a couple of weeks. Yeah. So I have... And you can explain what I have now.
So basically what we have, just at the styloid process. So if you imagine Billy's been ambulating differently to what he had been doing, and he's just loading structures that are now not happy.
Been dormant.
So rounds about the perineal brevis as we come down onto styloid process is a wee bit angry. So we do have a little bit of, well, we had some inflammation there the other day when I scanned it. And it was fairly significant. So what we found was around the synovium and just at the perineal brevis, we had active inflammation right there. So Billy's really been feeling it. He's overworked it, he's overloaded it, he's overdone it. We need to slowly build up. So we're going to need to give you just a little bit of rehabilitation. You start some more exercises. Sorry, Billy.
That's all right.
What we had, we did have grade 2 inflammation just at the insertion of the styloid process, perineal brevis at the styloid process, and it was bad enough that I did give Billy a steroid on Monday because you were pretty miserable with that. It settled a wee bit, but what we have to do now with this is slowly build Billy back up into slowly wearing this. That's a bit, but then also maybe look at what we can possibly do with the orthotic down this side. There might be some changes that we make to that, but slowly catch a monkey. The same mistake. Well, you never know, Billy. It is you. So what I'm going to do, after we've filmed this, what we're going to do, we're going to go upstairs. I'm going to scan the toe again, see how it's looking. So hopefully there's less. I don't expect it's fully going to be the inflammation.
I don't think it's fully going to be, no.
But I would expect it's less than what it was on Monday, and we will gradually get you built back up into this. Some rehabilitation for those lateral, so essentially perineal brevis and longus around here. See if we can get a wee bit of mobility around this. We'll see how you do with it. A bit of mobility and strength around this side here, and just slowly get that walking happening, because you've not done it for
no, I've not
pretty much the last 10 years.
10 years,
so we need to be easy with it. So this is quite we wanted to do this with Billy because I think it covers something that you're not necessarily taught in your undergrad, and even as our physio colleagues, you've probably done maybe an afternoon lecture in this. So it's an important thing that we're of. It is rare. You're probably, if you're going to see this in your career, some of you will never see it in your career, hopefully, but when you do, you need to be aware of it. Big red flags, things to remember, is persistent lower back pain. Okay, lower back pain's very, very common, but something just feels a bit different. Any numbness around the saddle, these are things that, irrespective of whether you treat the whole leg, because I know some podiatrists will only be in at the foot, but the foot is attached to the rest of the body. You need to understand your dermatomes, you need to understand that nervous system, you need to understand what's going on, and that patient might come in with altered sensation, altered power. You need to recognise these that could be possibly red flags. Okay, so don't just think, I don't know. You need to refer, and if you don't know, you refer that on so that it's not going to leave somebody with life-altering condition. Now, other things are, so any kind of changes around sensation, any bladder changes, any numbness around the saddle. And as a clinician who maybe is treating up to the pelvis area, say certainly our podiatry colleagues, and then obviously for your physiotherapist, you'd be quite possibly treating the whole body depending on where you specialise. You need to really be thinking about, maybe I have been manually manipulating this patient and it's something that I'm doing. I'm pretty sure Alan, your clinician who does mobilise, would have made different choices that he wouldn't have done maybe what he would normally do with you. He might have been like, well, there's something maybe no right here, or right. So it's about not just going in with, that's what I'm going to do with that patient and do what I always do. It is always any changes, but something's a bit different, Billy, right? Like, talk to me, what's going on? So you're not just going straight into the same old, something's different. And whether or not this would have had, probably not from the sounds of it, whether this would have happened, but we don't know. Right. So there's no point of that. But what I would urge us all to do is just to make sure that we are always looking out for red flags. And hopefully this just, maybe you weren't aware of some of these red flags, hopefully this gives you that knowledge. And, what I would urge us all to do is learn from each other, talk about our different case studies, and to work within that multidisciplinary team with our podiatry colleagues, our physiotherapy colleagues, our orthopaedics, our spinal, our nursing colleagues, and that we're doing the best that we can then to understand these conditions so that we can better look after our patients. So whether you're an osteopath, a chiropractor, whatever, we just all need to do better. That's just it. What would be your parting words then because this is clinicians, Billy, right, going across the whole of the UK and Australia. What do you want to say to them?
Well, I would say what you've reiterated, that understand your patient if you can. Don't be frightened to ask questions. I'm sure if that gentleman had asked me, say he'd been touching my hamstrings or touching my, can you feel my hands? Or can you feel my touch? Or whatever. Perhaps I might not have been able to feel it,
or even asking about your bladder.
Yeah, asking about the bladder or anything like that, if you'd asked me the questions. But also, don't be frightened to think, I've done something wrong, or this patient isn't there's something seriously wrong here. I need to tell him he needs to go to A&E or whatever, just to say it'll be fine, walk. I got from the guy that he couldn't wait to get me out the shop because it was a busy waiting room and he wanted his next patient. I would say that if you see somebody struggling to get off a bed, someone taking longer to get their clothes on, just say, stop, what's going on? Right, I think you need to go to A&E or something like that.
Yeah.
Don't be frightened. We all make mistakes. I've made mistakes in my job and had to put my hands up, admit it, and things like that. And it's better to, because I'm sure if I'd gone to A&E right from there that morning, perhaps I wouldn't have
as many
issues as I've got, because as the day went on, obviously they got worse, and I'm sure I wasn't helping things by wandering around and trying to squeeze myself into a car. So just that, it's just reassessing. I would step back, reassess, and go, right, okay, there is something not right here. Stop. Don't you get dressed or whatever. We need to, and maybe call another colleague in and say, listen, this is what we've been doing, and explain to if you've got another patient waiting, they'll be happy to wait 10 minutes that you get this right, rather than just thinking patients are okay. As long as they know what's happening, they're fine. If it's 10 minutes, half an hour, they're fine. So I would just say that it's just like reassess the thing. Don't be afraid to say, stop. I think there's something more serious here. We've done something that's not quite agreed with your body or whatever.
So don't just send it out the door and hope that you don't get any repercussions, or hope that the patient's okay. You have a duty of care, and it is your responsibility. And if you do something wrong, as Billy has said, you deal with it.
Yes, address the situation.
That's our fit to practice. We need to be doing that.
Yeah.
Mistakes do happen.
It's the human body. Anything you can't see through the human body, so you're doing your best to what you think you're able to do. Sometimes, maybe unfortunately, the patient maybe doesn't tell you something, and something happens, and that's down to the patient. And then as long as you deal with it, and as you say, patient care, that you care for that patient before they leave you.
Take it that person didn't phone you or anything later to check how you were, right?
No.
So to me, that's not right. It isn't right. If somebody left my clinic like that, I'd be.
I don't think he was letting anybody leave it.
I probably wouldn't. I'd log in, wouldn't I? So I think to add to that as well, one of the I suppose one of the things that I want to get across working with Billy and various different clinicians, obviously, I am a podiatrist. That is my specialism, but I treat the person.
The whole person.
The whole person.
Not just the...
No, and you get that from me, don't you? It's no just his heel pain I'm treating. I'm thinking about his back pain, how he's walking, how he's moving, your bladder. I'll be saying, how are you doing? What's going on? Are you all right? Today, actually, we were talking about your weight and stuff. We were like, how are you doing with nutrition and weight? And as much as I'm not a nutritionist, but if I thought, Billy, you're losing weight here, I see you quite often, you get that checked.
Well, that's the thing, as I say, you don't see yourself as others see you, and that's why I have talked about weight as well, is because I meet people that I've known for years and they can't believe the amount of weight that I've lost. Yeah.
So the point is that ask these questions. I think as podiatrists, we get a wee bit longer with patients than maybe some of our colleagues do, because the appointment times are a wee bit longer, because you're physically doing something, you're doing something quite technical, and that gives you time to talk.
Yeah, well, sometimes that's the thing, and probably you don't realise that you are. Sometimes people will say more to you than they will anyone else, because you're there for longer, and they will tell you about an ailment they've got. And even if it's something that you don't deal with, if they came back and said again, I'm sure you would say to them, well, I think you should talk to your doctor, or I think you should.
Totally.
So that's it.
It's just what you do.
Aye, that's it. You're a point of contact for all sort of. I know you specialise in a certain medical thing, but I think sometimes you're a point of contact for anything medical.
Completely.
When some people just open up a bit and talk to you about it.
From mental health to just being a listening ear. It was actually the physio yesterday was working on. I just had to go in and speak to the physio, and she was working on an elderly lady's shoulder. Lady had her top off, so I could see her back, and she had a mole that I was like, oh, that looks a bit, and I intervened and said, have you had this mole checked? I'm
Yeah.
not going to just ignore that.
No,
Although
that's
it
right.
wasn't my patient, just said, oh, hold on a minute. Now, we are trained in dermatology as podiatrists, so I'm always aware of this. And thankfully she had. She's like, oh, thank you so much for mentioning. Yes, I had it checked recently because it did look. But that's what I'm talking
Yeah.
about. It's
Things.
just always being aware and that little care to care for your patients. Thank you so much, Billy.
No